Welcome to our video on early warning signs and symptoms of fatty liver disease. Fatty liver disease occurs when excess fat builds up in the liver. There are two primary types. 1. Alcoholic fatty liver disease. This type is caused by excessive alcohol consumption. The liver processes alcohol, and heavy intake can damage it, leading to fat accumulation. 2. Non-alcoholic fatty liver disease. This is more common and occurs in people who drink little to no alcohol. It is primarily linked to obesity, insulin resistance, high cholesterol, and poor diet. If left untreated, NAFLD can progress to a more severe condition known as non-alcoholic steatohepatitis, which can lead to cirrhosis or liver cancer. Recognizing fatty liver disease in its early stages is crucial because the condition often progresses silently. In its initial phase, the liver continues to function normally despite fat accumulation, but over time, it can cause inflammation and liver damage. Once it progresses, treatment becomes more difficult, and complications such as liver scarring, cirrhosis, or even liver failure can occur. Early intervention, lifestyle changes, and treatment can prevent these complications and improve overall liver health. Symptoms of fatty liver. 1. Feeling tired or generally unwell. Fatigue is one of the most common symptoms of liver disease, including fatty liver. The liver is responsible for processing toxins, producing proteins and hormones, and regulating blood sugar levels. When it's not functioning properly, these processes are impaired, leading to decreased energy production and an overall feeling of tiredness. This fatigue can be persistent and unexplained, leaving the individual feeling constantly drained, even after resting. 2. Pain in the upper right part of the abdomen. This type of pain is due to the liver becoming inflamed or enlarged. The liver is located in the upper right quadrant of the abdomen, just below the ribcage. When fat builds up in the liver, it can cause swelling and discomfort in this area. The pain is usually described as a dull ache or pressure rather than sharp, and it may worsen after eating or when lying down. 3. Weight loss. Unintentional weight loss can occur in fatty liver disease, particularly as the disease progresses. The liver plays a key role in metabolizing nutrients, and when it's not working properly, the body may start breaking down muscle and fat stores for energy, leading to weight loss. This symptom can be concerning because it may happen despite maintaining normal eating habits. 4. Yellow eyes and skin, jaundice. Jaundice is a classic sign of liver dysfunction. It occurs when the liver is unable to process bilirubin, a yellow pigment that is formed when red blood cells are broken down. When bilirubin accumulates in the blood, it causes a yellowing of the skin and the whites of the eyes. Jaundice is often a sign of more advanced liver disease and indicates that the liver is struggling to perform its detoxification functions. 5. Bruising. People with liver disease often bruise more easily than normal. This happens because the liver produces proteins that are essential for blood clotting. When the liver is damaged, it may not produce enough of these proteins, making it easier for a person to bruise or bleed, even from minor injuries. 6. Dark urine. Dark urine can be another sign of liver dysfunction. When the liver is not able to effectively process bilirubin, excess amounts of it are excreted in the urine, giving it a darker color than normal. In some cases, the urine may appear brownish, tea-colored, or even amber. Dark urine can also be accompanied by jaundice and is a warning sign that the liver is not functioning properly. 7. Swollen tummy. Ascites refers to the buildup of fluid in the abdomen, which can cause visible swelling. This occurs when the liver becomes scarred or damaged, leading to increased pressure in the blood vessels around the liver, portal hypertension. This causes fluid to leak from the blood vessels into the abdominal cavity. As a result, a person with ascites may notice a distended belly, tightness in the abdomen, and weight gain, even though they are losing muscle mass. 8. Vomiting blood. Vomiting blood is a serious symptom of advanced liver disease and is often related to bleeding in the gastrointestinal tract. One cause is esophageal varices, which are swollen veins in the esophagus that develop due to increased pressure in the veins around the liver, portal hypertension. When these veins rupture, they can cause significant bleeding, leading to the vomiting of blood. This condition requires immediate medical attention. 9. Black stools. Black stools, or melena, indicate the presence of digested blood in the stool, which suggests bleeding in the upper gastrointestinal tract. This could also be due to ruptured varices or ulcers related to liver disease. The black, tarry appearance is due to the blood being partially digested as it moves through the intestines. Like vomiting blood, black stools are a medical emergency that requires prompt treatment. 10. Itchy skin. Itchy skin, or pruritus, is a common symptom in liver disease. It occurs due to the buildup of bile salts in the skin when the liver's ability to excrete bile is impaired. Bile salts, which are normally secreted into the intestines to aid digestion, can accumulate in the bloodstream and deposit in the skin, leading to intense itching. This itching can be widespread or localized, and it often worsens at night or in warm environment. Each of these symptoms indicates varying levels of liver dysfunction, and some are signs of more advanced disease. While symptoms like fatigue, abdominal pain, and weight loss may appear earlier, jaundice, vomiting blood, and ascites suggest more severe liver damage. It's crucial to seek medical advice if any of these symptoms are experienced, especially if multiple signs are present, as early detection and treatment can prevent further liver damage and improve health outcomes. Certain risk factors increase the likelihood of developing fatty liver disease. Understanding these can help people assess their risk and take preventive measures. Obesity. Excess body fat, particularly around the abdomen, is the most significant risk factor for fatty liver disease. Studies show that up to 90% of obese individuals may have some degree of fatty liver. Type 2 diabetes. People with type 2 diabetes or insulin resistance are at a higher risk because the body struggles to process glucose, which can cause fat buildup in the liver. High cholesterol and triglycerides. Elevated levels of bad cholesterol and triglycerides in the blood lead to fat deposits throughout the body, including the liver. Sedentary lifestyle. Lack of physical activity can lead to weight gain and increased fat storage in the liver. Poor diet. Diets high in sugar, refined carbohydrates, and unhealthy fats, especially trans fats, contribute significantly to fat accumulation in the liver. Sugary drinks, processed foods, and excessive fast food consumption can worsen liver health. Age. While fatty liver disease can affect people of all ages, it is more common in middle-aged adults and older individuals due to the cumulative effect of poor diet and lifestyle choices. Family history. A family history of fatty liver disease, metabolic syndrome, or type 2 diabetes can increase the risk. When to see a doctor. People should seek medical advice if they experience any of the above symptoms, particularly if they have risk factors like obesity, type 2 diabetes, or high cholesterol. Blood tests to check liver function, along with imaging tests like ultrasound, can help diagnose fatty liver disease. In some cases, a liver biopsy may be needed to determine the extent of liver damage. Since fatty liver disease often shows no symptoms until the disease has progressed, routine checkups, especially for individuals with high risk factors, are crucial for early detection. Preventing fatty liver disease largely revolves around maintaining a healthy lifestyle. Here are some actionable tips. Maintain a healthy weight. Gradual weight loss can significantly reduce the amount of fat in the liver. Crash diets should be avoided, as they can make the condition worse. Regular exercise. Engaging in at least 150 minutes of moderate aerobic exercise or 75 minutes of vigorous exercise per week helps reduce liver fat and improve overall health. Eat a balanced diet. A diet rich in fruits, vegetables, whole grains, and lean proteins, while low in saturated fats, trans fats, and refined carbohydrates, supports liver health. Avoiding sugary drinks, processed snacks, and fast food is essential for reducing fat buildup. Limit alcohol consumption. For people at risk of fatty liver disease, it's important to reduce or eliminate alcohol consumption, which can further damage the liver. Monitor cholesterol and blood sugar. Keeping blood sugar and cholesterol levels under control through diet, exercise, and medication, if prescribed, can help prevent fat accumulation in the liver. Regular health checkups. Routine checkups, including liver function tests, are essential for those at risk. Early detection can prevent the progression of fatty liver disease to more serious conditions. Fatty liver disease is often asymptomatic in its early stages, but recognizing subtle signs like fatigue, abdominal discomfort, and changes in appetite can lead to early diagnosis and treatment. With proper lifestyle changes, such as maintaining a healthy weight, eating a balanced diet, and exercising regularly, many people can prevent or even reverse fatty liver disease. If left untreated, the disease can progress to serious complications, which is why it's important to be aware of the risk factors and take action early.